Welcome everyone. Welcome to the Physiatry Mentors. I'm Dr. Sheena Bhuva.
I'm Dr. Benecia Williams.
And together we are Sheena. Okay, so today is basically our trifecta. You know, we spent some time with UTHealth San Antonio, where Dr. Carol Lee was our guest last week, and she's doing inpatient. We just finished up her position doing inpatient rehab, so you can guys check out that video. And then we had an awesome IG takeover last week. They did a great job, the residents and the attendees.
Great job.
Yep. And today we have the honor to have Dr. Monica Verduzco-Gutierrez. She's the chair of the UTHealth San Antonio program. And you guys, her resume, we spend time, saying everything on her CV. It would take the whole hour, but she was the prior program director over at the UTHealth and Baylor College of Medicine Alliance at the TBI program. She's very involved in a lot of our organizations and has a special interest in neuro rehab and spasticity. So we'll go into a little bit about, her journey and kind of what she does and how she does it. And yeah, so thanks so much for joining us.
Yeah, we're super excited to have you.
Yeah, thanks for having me. I've been kind of watching intermittently. Sometimes I drop in, say a little hello, listen in. And so I'm really excited to get this opportunity and just want to promote anything to do to promote PM&R, to support other women in PM&R, and to just get the good word about our field and about my program. Then I'm here to do it.
Oh, we appreciate you. You're such a mentor to us. So tell us a little bit more about yourself. Tell us where you're from and your educational background.
So I'm originally from deep South Texas. So even though, now I'm in San Antonio and they consider that South Texas, but I'm from even more south, like at the tip of Texas, or what's also called the Rio Grande Valley, and was raised there. It's also, heavy Hispanic area because it's on the border with Mexico, probably like the 4 counties that are there, the poorest in the state of Texas. And just from a very large Mexican-American family who are really supportive and loving. And even though my parents were the first generation to go to college, they were from huge families. Like my mom is 3 of 13 kids, and where her parents go to, didn't get any higher level education, and they're just really supported education for their children. And so then my parents had really supported education for us. And, I was just like nerdy hustler girl, even from growing up, and went to McAllen High School. I would try to get my kids into, I was on the math team. I was a mathlete, and they're like, "Oh, Mom, no, we don't. No, that is not cool." I was well-rounded. I did other types. So I ran and was a good student. I graduated first in my class from high school. I went to McAllen High School. And then from there, I went to Rice. And, I just thought I was, I was smart. I was first in my class. I really did well in everything. And Rice is like full of super smart people who went to all sorts of excellent high schools. And not to say that mine wasn't, it was just, different place, different kind of educational background, just kind of what I said. My high school started with 1,000 students and we only graduated 400. So just a lot that end up not making it through the system, that end up having to drop out. And so it probably wasn't as rigorous as some top private schools. And the other my class at Rice, 1 in 4 were valedictorians. So it was like everyone was the smartest person.
Yeah.
Everyone went in with, they had 50 AP credits, and I did not, but so, I went, it was like, okay, I'm going to work hard, but I had fun too when I was in undergrad. I did not major in a science. I majored in Latin American studies, and I studied abroad for a semester, and I had lots of fun doing that. I went to Santiago, Chile. So that was, it was very fun. It was fun. It was very, very fun, but it was also really shocking. Just, being in a completely different culture, and being so far from home. I'd never been, my family was at least in Texas before, and then now it's in another country. And then it was also convincing my family to go, because it's like, this is our first daughter, you going away to another country, no one's going to be there, you're going to be living with this random family. So, you know, it was other outside people had to help convince my parents that, okay, she can do this, it's fine. And so I did, had lots of fun there, made connections there. And then when I say the most helpful class in undergrad that helped me to be a doctor now, it was medical Spanish. So no, I did not major in bio. I had to take all the classes to get to medical school, but I feel like that experience that I had in undergrad kind of made me more well-rounded to help me get ready to be a physician today. And then the other thing was I was in the Rice Baylor program. So that was a program that got in directly from high school, and there was a certain amount of maybe like 8 or 10 students that would get direct admission to medical school at Baylor College of Medicine, as long as they met some, you know, you had to have a certain GPA, but it wasn't a 4.0, you know, and you had to take certain classes. You had to take the science classes that you need for med school, but I didn't even have to take biochemistry. So that was kind of nice. Nor in that time did I have to take the MCAT. So yeah, great. Yes, wonderful. And so was just, you know, really blessed to be in that program, really had a well-rounded college experience. And then after that went to medical school. Well, medical school was then another shock because it's full of, you know, super smart people who had just like majored in all the science classes. And I'm, you know, coming off of medical Spanish. So at least I had that. And so at the beginning, where it's a bunch of basic science, I had to just like start like day one, and I'm studying, I'm working super hard because it's hard and everyone there is really smart. I went to like every class. I was there. I was on the second row. I'm like taking notes, highlighting. I had like a special highlighting nerd thing going on where it's like, okay, I'm going to highlight what I think is important in yellow when my pre-reading, and then whatever the teacher says, I'm underlining in red. And then, you know, what I study later, I'm, you know, going to highlight it in a different color and write a different note. And then I like befriended the smartest, like the MD PhDs. I made my friends because they were going to be,
yeah,
they understood everything and be like that extra level of,
it's a system.
if I needed something explained to me, I'd be like, hey friend, what's please to me, because I never took biochemistry or whatever it was. So so med school was good too. I mean, I had fun. I, you know, studied really hard from the beginning. I also had a really tough time my second year of medical school. Just my dad got colon cancer and had a recurrence of his colon cancer, and he was a patient at MD Anderson, and it was just like a lot of life stressors going on at that time. And it was, they had changed the curriculum then. The pass was 80 instead of 70. And so, and then they had one section where it was like, okay, you have, there's 3 mini sections, and those, of those 3, the average is going to be passing, but you have to pass with an 80. So it was like, I passed the first mini section, the second mini section, I got a 78. And it was just like
heartbreaking,
like, oh my gosh.
Yeah.
Do I belong here? Do I belong in medical school? This is like the most terrible thing to happen in my life to that point. With, on the same day of that test was a day that like my dad went to emergency surgery. And which the professor was like, whatever, you know, like, who cares?
Right.
And so, but the other thing was that they had an office of diversity that really cared a lot about the students. And they were like, okay, we'll get you a tutor. And they got in a 4th-year tutor who was someone that was like super smart, and they helped like work through the next topics. And then I was just killed it after that, you know? And so like, okay, I made it. But it was a lot of even imposter syndrome when being in medical school, like, do I really belong here? Look what happened. I'm so stressful and tough. But I made it through. I did well. I, you know, went through medical school. I didn't, you know, so I'm very thankful to make it through and shine. So
Shine you did, right? So
Yes, you did.
That's my schooling.
right. Okay, so once you were in medical school at Baylor, how did you get exposed to PM&R? Obviously, Memorial Hermann here is over there, and so when did you decide to apply to PM&R, and how did you decide that was your specialty?
So as for PM&R, so I didn't go into med school even knowing about PM&R. So since I didn't know about it, I didn't want to go into it. When I went into it, I wanted to go into pediatrics because I just had this, like, growing up, I really looked up to our pediatrician. He was, Hispanic male. He himself had gone to Baylor, actually. And I thought, like, oh, and I loved kids and I wanted to help kids and go back to my community and do pediatrics. And even after my first year of medical school, I did the summer program and I got to go back to the Valley and work and shadow him when I was after my first year of medical school. And then I didn't learn about PM&R until the next year. They had a preclinical elective that was sports medicine. So I said, well, I should do this elective because if I'm going to be a pediatrician, there's going to be, kids who get injuries and who are into sports. So I should do sports medicine. And when I did sports medicine, that preclinical elective was actually put together by the PM&R department. So it was my first exposure to, oh, this is the PM&R department. And they, it was divided really nice by, these are the knee injuries, these are the shoulder injuries, these are the head injuries, and these are the para injuries, or this is what happened with, para athletes. And so it was kind of nice to get that initial exposure to PM&R and to, oh, this is a field. They also do sports medicine. They also take care of patients with disabilities. How cool and interesting. And I did in my first elective that was like, well, they have selectives then, I don't know what they have now, but it was 2 weeks and I did a 2-week rotation and it was with a woman physiatrist, Susan Garrison, and she did a little bit of inpatient, a little bit of outpatient. And I just thought, like, oh, her practice is amazing. Like, she saw some patients in the inpatient unit, and then she had this clinic where actually, even though she wasn't a DO, she got trained a lot in osteopathic techniques and would use that on her patients. And it was like, oh, what a really wonderful relationship that she had created with her patients, and that she was following some of them long-term and helping them both, like, through the worst part of their life when they're in inpatient rehab, and then also, as other needs came up for their chronic or acute disabilities. And then there was a resident that was part of the program at Baylor, and he had actually gone to Rice, but was older than I was when I was first there, or he was graduating when I was, a freshman. And I was like, oh, I met him. He was a PM&R resident. And I was like, oh, he's a cool, normal guy. He says this is a good field. I should look into it a little bit more. So now actually he tells me that I was his contribution to the field. Because I told him, oh, you got me really interested.
That's a big contribution. Thank you.
And so the rest is history. It was nice to be at Baylor College of Medicine then, because there's so many rotation options because TIER's there. And so I got to do different rotations and get really exposed even before starting residency, and getting exposed to lots of different, I did like pediatric rehab. I did some cancer rehab at MD Anderson. I did a rotation partially at TIER. So just kind of got exposed to a lot of things before residency. And then
it was helpful.
It was helpful, yes. And then residency, I ended up going and doing a residency there with Baylor and UT. Then it was kind of alliance where we went to all the hospitals around the Texas Medical Center and did our rotation. So there's also a story about residency. I looked into all different programs, knowing that I had this, excellent program at home. But the other thing that I kind of considered at that time was my life and what I wanted for my personal life as well. One of the deans at that time talked to me when I was trying to decide on my match list, and he's like, what are your priorities? And really think about what your priorities are. And if your priorities are really like God, your family, and then, your career, then think about those when you're making your rank list. And so part of me knew that I was already married at that time. I got married when I was in medical school, and thinking like, oh, I'd want to start a family. And so we had family support in Texas, and the program's excellent. So, it would be, I would make no mistake by staying. And so I did. And
that makes sense. Yeah, no, that makes sense. So you specialize in neurorehab with traumatic brain injury and stroke patients, and do a lot of spasticity care. Has that always been your goal, or did your career kind of evolve into that?
It was somewhat my goal, and it also evolved into that. So that's one thing that I think is important, is like flexibility, but still going back to what you love. So when I was a resident, I kind of, you try different things, you love different things, you do different things. And it was like, ooh, do I like pain? I like procedures. Yeah, that's pretty neat. But do I like pain patients? Maybe not as much. Sorry, guys. And I just loved the idea of, even though maybe the sports medicine elective is what got me to it, what eventually like really captured my heart was the more chronic brain injury, neurorehab, spasticity interventions. And maybe it's also just where I was, and that's, you have so many mentors there that are really into brain injury and spasticity, and they're some of the leaders in the nation. So it's like, well, I really look up to, Dr. Cindy Ivanhoe, and she's this amazing, like, woman who also has kids and was balancing that and being able to work, and do interventions and take care of her patients and see good outcomes. So that's kind of why I loved it so much. And then I had the option when I was a fourth year, what was I going to do next? So of course now brain injury fellowships are accredited, and you do fellowships if you want to be certified. But back then, brain injury fellowships were not accredited. And so I kind of had the opportunity to, it was like, well, I could do the brain injury fellowship, or I could take a job with the department that was also hiring, and then just kind of, well, I'd already learned from the best people in the field, and we'd really done a lot of brain injury and really done a lot of spasticity in our residency. So then I can just, pick it up and practice. Not to say that practice wasn't like, oh, you start and you're like, I'm the best person ever, or, at the level I am now, but it's a lot of, a huge learning curve, and you just go with it. And so that's what kind of became my practice. But the other thing that I always recommend is just PM&R is a diverse field, so really stay diverse in what you can do. So I'm a big sayer of yes. I kind of go with the flow. I'll say yes. I'll do what needs to be done for the team. And so does that mean that I do some general inpatient sometimes? Yes. Does that mean that I did EMGs for 10 years? I did do EMGs for 10 years, even though that's now like probably one of my least favorite things. But I can do them. And, did I do a neuromuscular clinic? I did. And so it just kept me at least diverse. And do I know how to, if I have a chronic pain patient? Yes. If someone has acute pain, do I know what I can do, and then who to send them to? Yes. Right. I'm not going to do any spinal injections, so I'll leave that to y'all.
No, that's what Omar Swad, who's a big fan of yours, and my partner and mentor, he has always told, he's like, you want to stay diverse as possible. So I know I have a very diverse practice. I do injections, I do a little bit of inpatient rehab, I do consults, but I do a lot of spasticity care. It's actually one of my most rewarding injections, is doing botulinum toxin injections.
Right. Because it works, and you're putting it where it's going to work. And
yeah, it's awesome. And it makes a huge difference in a person's life. And I was going to ask you, are you doing any CBD at all in Texas?
No, not. I mean, some of my patients are, but I'm not prescribing.
No, we'll talk about it after. Okay.
Yeah. And that's the thing we've always stressed, PM&R, super diverse field, small field, but very diverse. And it's great. I do mostly spine interventions and EMGs, but having that background, having a patient who's had a concussion and has not had any proper workup, or even, after spine surgery, having still some bowel bladder issues, and there may be issues there. So knowing and recognizing those issues and being able to, send that patient and being that advocate for them, I think is huge, and kind of what sets us apart from other pain management, specialties and things like that.
Yeah, you've caught a lot of things on patients, but just doing the exam, you're like, you have an upper motor neuron sign, like something not quite right. Yeah.
Yep. Yeah. The other day, or you cannot, if someone comes they've been seeing other places and they're like, I had an EMG and I have a foot drop and they said it was a ridic. And then you look at the report and you're like, not really agreeing, because you know how to read reports. And then the other thing, like, so you have an ultrasound. So then you grab it and you like measure their fibular nerves and they're different. And then you know, oh, actually you have a fibular neuropathy. So yeah.
That's very cool.
Love our field. Yep.
Yeah,
all right. So, in our in our intro, we mentioned that you are the chair. You were recently appointed the chair at UTHealth San Antonio. So congratulations. That is awesome. And your subspecialty kind of leans you into academic medicine. Was that always something that you knew you wanted to do? And did you ever think that you were going to be a chair of a residency program?
I think in the beginning, all you think is like, I need a job. But the other thing was like talking about mentors and people that you have around, is that's kind of what you see, and everyone's academic and everyone's working at that level and taking care of patients that way. So you think, oh, gosh, I would really love to do this. I love to teach and I love to have residents around, and I love, this environment where you get these difficult patients and you get to take care of them and help them. And I think that's one thing that definitely drove me to going into academics. And I have, I guess I've always been in academic medicine, though there were some times where I considered like, oh, this is a lot of work, or should I try something new, and then kind of came back to, why did I want to do this and why I love this so much? And so for myself, I knew that, okay, I love this patient population. I love teaching residents. I love, just being able to try to do research and go to conferences and make presentations and, touch lives that way and interact with medical students and trainees at all levels. And so for that reason, and there's different ways to do that, like y'all are doing right now. But for me, then I want to stay into academic medicine. As far as, did I think I wanted to be a chair? I don't think on like 10 years ago, I would have said, oh, I want to be a chair. Or, I hate that, like, where do you see yourself 5 years from now? Where do you see yourself 10 years from now? Because I just feel things change. I mean, look at 2020, right? And I'm all for, be flexible, go with the flow, see what comes in your lap. Because I probably wouldn't have said like, oh, I'm going to be a chair. When I started, thought like, I want to be a chair. I think it's just something that, I started doing. I started seeing the importance of, okay, well, if I am in academics, then I need to make the most of it. And what do I see is important to do? And then the other thing is like, I got more kind of enthused about gender equity and diversity and inclusion. And with that came seeing where there's lack of sometimes diversity, both women and also underrepresented minorities when you look at ethnicity and race in higher ranks, and said, I can do that too. I'm very successful. I've worked very hard. I've moved my way up. And so then also, I guess I look up to these chairs that I've worked with or that I've interacted with, and said, I guess it's always like looking up to someone and say, I want to be that, or I can be that. And when it came for this opportunity, it was one of those things. I was even talked to one of my mentors, Julie Silver, and she was like, well, if it's something that you are thinking about, what's it going to hurt to even apply? What's the worst that they're going to say? They're going to say no. You're going to go through, and maybe it's a practice, like you go through this process, and I learn, and I learn from that and say, okay, maybe next time, or maybe this wasn't the time, and so it just happened to be the time.
No, that's awesome. We're so happy for you. I know I told you earlier, Sheena and I look up to you, and we're like, oh, she's such an inspiration. You are definitely in line with what we're in line with. We're advocate for women in medicine. We're advocate for our field of medicine. We love PM&R, and definitely for females and minorities. So you do such a great job, and you're a wife, you're a mom, a chair, and you're a runner. And we're like, how does she have time to do it all? So what tips do you have? I'm sure you must be a very organized person.
I don't ask my kids or my husband how good I am at that. No, but,
No, that's so funny.
so I always say that it takes a village, and I definitely have a village. And so when they're like, you do it all, I don't do it all. You know, I have support systems. So I have a husband that's amazing, and he works full time. And it was kind of nice during this move. And in the pandemic, he's worked from home a lot in the job that he's done. And before, he used to travel all the time, and I couldn't imagine him being traveling. And then me taking on this new role and us having to move to San Antonio in the middle of it. But thankfully, he has a good job where he can work from home and be able to do what he does from home. So he can help coordinate things. He does a lot of stuff with, coordinating the kids and what they have to do. And he coordinated our move here to San Antonio, and, all the contractors that had to help renovate the house that we live in now. And so he's a great help. He's also like the husband that likes to clean and cook and do that kind of stuff as well. So that's great. And then we have maybe
the dream.
the dream. And then my kids are a little bit old enough where they can do a lot of stuff for themselves now. So maybe when they were little and I was a resident or an early attending, I couldn't do a lot of things except, I could work, and maybe I didn't get to go to conferences and present and do that much because the kids were little and they needed me a little bit more. And now, granted, they need me and they still have, things that they need, but they can do stuff like go clean up your room. Not maybe they don't do a good job, but they can go do it. Or, hey, go take a shower, put yourself to bed. They can do that. They can entertain themselves now. They can be at home by themselves now. So, that's kind of very helpful. They don't ever like Zoom bomb my meetings or anything. They're like, no. And as much as I love that, like I love a good like little baby come into a meeting or something, but they're old. They're too old for that. And then the last thing we have is, so my in-laws live with us. So my husband's parents, they even moved with us to San Antonio, and they're a big help. My mother-in-law is amazing, and she also helps. Like I come home and the food's cooked every night, and she helps with. When we lived in our other house, she would come in the morning and help make sure my kids are ready for school and get them off to school, and she'd pick them up from school. Do that so that we could have a nice two really hardworking parents and have wonderful family support. And she's taken care of the kids since they were babies as well. So yeah,
that's awesome. It's very important to have a support system. I know Sheena and I, that was maybe the reason we stayed in our area. Like our families are here, and we definitely wanted to be by our support system.
Right. And and now I'm closer to my parents too. So
nice. Good.
No COVID, they can come a lot more.
And you touched on something, how early on women physicians who have children, it's harder for them to be able to go to these conferences and maybe take the time and, and the energy to put into doing research projects and all of that when their kids are young. So I think we do see that as we get older or more established in our careers, more opportunities come up where we can, take those more advanced positions like program director, chair, and, all that kind of stuff. So there's a lot of research on that.
At any time, they just make it work for themselves, because sometimes actually, if you look at some of the burnout literature, is even mid-career women get burnt out, and that's, or may not have as many opportunities. So it's kind of different for everyone, and just,
All right, so obviously this year is way different than any other years when it comes to applying to residencies and interviews. So it'll be a virtual interview season. So do you have any advice for upcoming medical students, how to navigate this new process we're all going through?
I know. So first I want to say that I'm so sorry that everyone is having to go through this, because it's tough. It's unfortunate to kind of change everyone's life around. And especially as a med student, it's a super stressful time of your life where you're just like, I have to take these tests, and the tests matter, and those scores matter, and my interview matters, and I have to look good and say the right stuff. And I'm, and you're not getting audition rotations like you were getting before. You're having to find some other kind of opportunities to do what you want to do. And you're not being able to go to a place and feel what the real feel is. And, maybe your test wasn't the day that you wanted it to be, or they canceled it and it's expensive, and, on and on and on. So I'm not without feeling a lot of sympathy for medical students right now during this really stressful time of their life. And so virtual interviews, I think what you have to do, what you would do in real life. So that means practice. I would recommend getting on Zoom calls with friends, or even if it's FaceTime with friends or with people who are maybe already residents or mentors who would be able to want to do kind of practice calls with you and go through some questions and see how you do. I think you have to also prepare. So other than like preparing yourself that way, which is important, but also when you practice, make sure that you're practicing with the computer in the right, angle and way. And I think you had posted once about, how to make yourself, have the light that's right, the background that looks good. And I do recommend, maybe even if your medical school allows you to do it, where you can actually have like plug in Ethernet access, so you don't have bad connection, because that's, you don't want to have a bad connection, you're cutting off in the middle of your interview. So kind of just doing everything beforehand to try to make sure that nothing goes wrong. Like your computer's charged, you have Ethernet connection, the lighting's good. Even, sometimes some people even buy those little circle lights so that they get the best light on them. So just making sure that
Benecia has that. Yep.
Yeah, nice. It looks great. Making sure that, the computer's not looking up your nose the whole time, and just, because all these little things matter. You have to kind of put your best face forward. And so that's just, I hate to say those little things matter, but they do, and it'll just make yourself, look sharp and look professional and look ready for these things, and to be ready too, because you practice type of questions. The other thing, I think it might be good for some people who are otherwise a little bit more nervous in person, because then you get to be kind of in your own surroundings and feel very comfortable. So that's kind of nice. That's one thing that I even heard from people who took oral boards this year, where it was a little bit different, where they said, well, I felt not as anxious because I got to be at home sitting, in the comfort of my home, and not having to be in Rochester and, super anxious waiting outside that door to go in.
Right.
My hands were literally shaking right before I walked in. I was like, calm down.
Sweaty.
Yeah.
Sweaty, right, and sweat for sure. Yeah. So, so that's kind of nice as well, that, hopefully.
And they're saving money.
And you're
it's
saving
a big
money.
positive. So much money. Yeah.
Lots of money. Right. Yeah. Just kind of practice answers. People ask pretty similar stuff all around. They always ask about things that are on your CV. They ask about your strengths. They ask about your weaknesses that are really strengths hidden into weaknesses.
Yeah, absolutely. When does interview season start? Is it next week?
It's not that soon, because they kind of delayed a lot of things with like ERAP.
Okay.
And so it's just barely opening up now. And so it's going to be more next month, starting next month, November, December.
Okay.
So it's giving students a little bit more time. So
yeah, maybe we'll start with that week before, Sheena. We can start putting like posts on our page, like little tips for the medical
virtual interviews.
Yeah.
I have a question. Are you guys, since you're on the other side, making these decisions about medical students and ranking and all that, are you guys doing anything different, or are you, putting more weight on some other stuff than others when it comes to this year?
This year we are doing some things a little bit different. So also me just coming in and being like, okay, how do we do things before? I'm very big about diversity, inclusion, et cetera. And so kind of saying, all right, well, we're going to want to do, and I already have a paper that's published that's talking about mitigating bias in virtual interviews, especially for students who are underrepresented in medicine. So it kind of starts at the beginning where, you take your faculty and you say, this is something that's important to us. You can kind of put we have a diversity statement for our department. You can kind of have that as a reminder for them before any of the interviews. You give our faculty implicit bias training so that they kind of recognize what their biases are going to be. So, we just kind of start off by putting that out there. The other thing is, once we start getting applications, we're going to kind of do a more holistic review. So it's not just going to be like, oh, you have to have like your 99th percentile on the boards and that's all who we're going to accept. No, it's going to be, okay, we need well-rounded students, and not just the ones who have the best scores, but a diverse in, backgrounds, ideas, what they've been through before, et cetera. So languages spoken, et cetera. And then we're gonna also maybe try different interview techniques as well. So, yeah.
That's awesome. Good. Yeah, I'm very interested to see how this goes and after match goes. Sheena and I were talking about, we are wondering how big social media is going to be for people when they do their rank list, because like that's why we started the things like the takeover. It's like, how are you supposed to know these programs if you can't see into it, right? So I'm right. So I'm very interested to see how it influences people to even apply and do their rank list.
It's a definite thing for those who may be underrepresented anyway. You want to go somewhere, you want to see what the environment is, you want to see what the culture is like, and you need to get that feel for what things are like. And if you're doing it virtual, you may not get that same feel that you would get otherwise going to a place. So I think that's why it's nice to have these other options, like seeing the social media sites, seeing what their website's like.
Yeah.
So yeah, we're in the middle of even redoing our website to have just kind of more information and just putting more information about, the residents and our interest in diversity and even my information. And like, okay, let's update our old website. And then I also was like, let's start social media sites. And they've like really taken off with doing social media and really showing, the great things about our program. So yeah. I'm really proud that they've like just taken off with it. And I don't think they used it as much, like maybe applicants didn't use it as much in years past, but I think for this year, it's
definitely.
Yeah, it's almost a month.
Yeah. Last year when I was at UT Houston, we actually did a little QI project or a small research project, and we had all the people that had applied. At the end, we gave them a paper survey about if they use the social media sites to look up information, and it's like half and half. It wasn't that many, honestly, but I wonder like, if they did it again, what we would.
You guys should do that, yeah, because I'm very curious, because I'm like, I remember when we were playing, like social media was such a negative. Like they're like, change your picture, change your name, lock it down. But now I feel like it's just the way social media is here. It's here to stay, and it should definitely be appropriate. But that's how this in the pandemic, and we're in a virtual world. So
we are, and that's the way people want it to be now. It's the way kind of the future. We did another paper that looked about adaptations to physical medicine and rehab, both for physicians and for residents. And we surveyed med students, residents, physicians. And one thing that we saw from med students and residents is they like virtual conferences. They like virtual didactics. They like the ability to work with other programs and other people and be able to engage that way. And so we have to, change the way we teach and the way we do things and adapt.
#adapt. All right. So if you guys have any questions, please write them down here. So Dr. Salad mentioned before, he's one of our mentors, and Benecia works with him. So he has a few comments for you. So so he has 3 daughters, 2 in college, wanting to do medicine. He calls you Dr. MVG. Is a wonderful role model for young aspiring female physicians. We agree 100%. So he has a question. So when students apply, do you like it when they come in open-minded, or what if they think they know exactly what they want to do, such as like pediatrics rehab or pain? Is that okay if they tell you that? Basically he's asking, what is your advice to med students applying, sort of like how to project themselves with their interest in PM&R?
I think they just be honest, and I know that that it can change. It's if they really have an interest in something and they say that, that's fine, because I know that, I thought I love pediatric rehab. I guess it made sense because I like peds first, and then, I did pediatric rehab and I like that. And then when I did the rotation, I was pregnant. It was like the saddest thing in the world. And so then that ended up not being the thing for me, or that I didn't end up doing, though I sometimes still get adolescents, or we'll be happy to take care of the younger kids or the transitioning CP kids. But, people change their minds. So you can say, the student applicant can say what they want to do, and just, I know it might change.
Yeah.
as long as, and they're usually adaptable.
Yeah, I tell people definitely keep an open mind because you just never know. So many people, I think for me, when rehab really started like coming together, and I know Sheena and I've talked about this, like after a spinal cord injury rotation, you're like, oh, it all really like clicks because you learn so much about the musculoskeletal system while you're in your SCI. So it definitely helps us become better physiatrists and sports and spine physicians. So yeah, keep an open mind. You never know.
Yeah. Yeah. Then maybe hopefully I can just woo them all to brain injury and spasticity.
All right, so Sarah asks, what have been some challenges as a new chair and part of the 1% of chairs that are Latina?
So I think some of the challenges are just mid-pandemic that, everything coming in, you have this whole thing like, oh, this is your chair package that we wooed you with before you started, where you had this wonderful vision. I was going to bring in all these people and start all these programs. And then the pandemic happened and it's like, programs closed, like nothing's happening. Oh, money, we have negative money, put those ideas on hold. And it went from here's my visionary thoughts of leadership and everything that I'm going to do to more of okay, let's switch and it's kind of like, I don't know if there's an official term, like more of a holding type of leadership, like, okay, how can I support these faculty during this really difficult time where things are shut down? It's scary. Research has changed and our unit was closed for some time and EMGs aren't going and family stresses and COVID's all around and you're hearing things. And so just went into kind of, again, talking about change and pivoting and what can we do during this time and just being as supportive as possible with still knowing, okay, we have to build this program still in the future, but for now, what can we do to just keep everything stable? And so that's definitely a challenge. Just a lot of different expectations, like everyone, oh, how's San Antonio? Are you having fun? Are you living it up? Well, this is not really, no one's living it up right now. Well, if you are, I'm very angry at you. Like,
wear a mask.
Wear your mask.
Wear a mask, social distance, stop going to a bar, whatever. And it's just time to, I guess also to reflect and be really grateful for what you do have in your life.
All right. Any other questions?
With all this virtual, like, okay, well, now what are we going to do for interviews? What are we going to do for everything else? So,
yep.
Yeah. Okay, next.
All right. Dr. Slott has put a bunch of different comments. I guess I'll read it. So he goes, one day in Orlando, my docs told me to find Dr. MVG and get a selfie with her. I found her in the exhibit hall and did it. I told her why. She had no clue about it, but it was pretty funny. My colleagues are big fans, so I had to do it. So
I don't know, I work with Dr. Lan Lee, who does TBI mainly, and Dr. Neha Shah. So we always talk about our women's physiatrist group in our office, and Omar gets very jealous that he's not part of this group. So, and I've heard other people say like their male colleagues are pretty.
Yeah, mine too. I have 2 PM&R male colleagues, and they're jealous for sure.
We're like, oh, it's like, because we're always like, it's okay, we'll ask the group, we'll ask the ladies.
Love it.
It's awesome.
It is. But that's a great thing. We were talking a little bit about going to conferences and being able to meet people that way offline a little bit. Yeah.
Yes, when things open up, we definitely have to have a women physiatry get together.
Together, for sure.
For sure. All right, we have another question just came through. Tim is asking, with interviews being virtual this year, what is the best way to see how much a particular residency program values diversity?
Mm-hmm. So I think
look at the residents.
Their residents, look at their faculty, look at what's around, ask the questions, ask when they give you time, when you're interviewing, you ask the question and, how do you value diversity? What's being done at your institution? If they have zero idea, then maybe you will get your own idea too. Mm-hmm. We're actually in the middle we submitted a paper where we looked at all the PM&R programs and if they had diversity displayed on their websites, and very, very few did.
I believe it. I believe when we were very lucky. We called ourselves like the World Health Organization for our program, because we were like, we were the most diverse program, because there was only 9 of us, but we were all something different. It was very cool. But now I think it's all boys. So.
That's a different thing. All right. All right, Benecia, you want to do the honors? Oh, we're just still. Okay.
We got another question. Yeah,
trickling in. All right. So what did you run in? So Alexis asks, what did you run in high school? I follow the Mama Docs Run Instagram page and is such an inspiration from a fellow runner.
Oh yeah. So in high school, I ran the 800 mostly. Also sometimes did the 4x400 relay and the mile. So anywhere between the 400 and the mile was my, and then I ran cross country too. So that was
how many miles
and
do you
then I ran cross country.
And then you're like,
I did 400 and then I ran a mile and a few more miles. Yeah.
How many miles are you clocking per week now?
So it just kind of depends. I don't like to run every single day. I kind of like to do different things, which is kind of one of the bummers about not being able to go to the gym, because I used to be able to, I love kickboxing class and I love, body pump and I like to do weights and stuff. But so I have been running a little bit more, or I have a Peloton and do the bike. So maybe if I run 3 or 4 times a week, and each of those times will run anywhere between like 4 and 10 miles. So whatever that ends up being.
No, that's awesome. Yeah, I'm a Peloton. We're Peloton fans, so a bike game.
Right. All right, we have a few minutes left, so we'll do this last one here. Shamaka Ukoha says, you mentioned many papers, research projects you've been a part of. Do you have any tips on how to get started on a project?
I think you just have to kind of find something that you're interested in doing, find a question, find a hypothesis that you're interested in, see if it's been studied. If not, then what can you do to, start looking at it, and how you can start asking the right questions, and how you can get to your hypothesis and how feasible it is. And then you can find possible mentors that might be interested in what you're doing as well. Even asking other upper level residents or some of the attendings that you maybe have interacted with, or if you go to a conference and you see something, that's why you go to those poster sessions and you look, and it might be something that you're interested in, and or even go to program directors and say, do you know anyone interested in this, or who would want to work with me on this? And so I think it's about, not being afraid to ask and go out on a limb.
Great advice.
Absolutely. I know Sierra had asked about COVID rehabilitation. We actually have a really good talk, Sierra, with Dr. Rachel Welbell, who is a sports medicine doctor turned COVID rehab doctor. Check that out.
Hashtag adapt again.
Yeah, hashtag adapt. Yep.
Hi, Mrs. Bhuva.
Oh, my mom says hi.
Your daughter's awesome.
Speaking of family support, and having great support system. All right, Benecia, go ahead.
So, last question, very important. Monica, if you were not a rehabilitation physician, what would you be?
I would be a personal shopper for some really rich people.
Nice.
That would be so fun.
It would be so fun. I would buy everything.
I like that answer.
Being able to buy, just put really cool, thoughtful gifts together. So,
That's
and it's
awesome.
better than someone else's money.
Yep.
Otherwise, but probably also, or something still in the realm of, I care so much about diversity and inclusion. There's other fields where they need that to be done. It's not just in medicine. So something in that field if I had to have a real job. That was
a real job.
People are like, what would I do? I don't know. Yeah.
Right. I know. I love what I do, but
and that's people should take that, because every time we ask that question, everyone's like has a hard time, but we all genuinely do love our job, which is very important.
Right.
All right. Well, thank you so much for joining us. This was super fun. We really appreciate you. I know you're busy just moving into a new city and all of that. So we really appreciate you taking the time out and spending your Sunday with us. So
Thanks so much for having me. This was great. Good chatting.
Great. And so, we know you're very active on Instagram and Twitter. So for those who, for whatever reason, have not seen you on there, what is your handle?
So one of the rules is you should have like the same name for handles, but I don't. So. I think because I just had Instagram first and kind of like, oh, that was my name. So on Instagram, I'm Monica V. Gutierrez, and that's my Instagram handle. And then on Twitter, which I use a lot more, Instagram's kind of like running and work too, and also just family. And then Twitter is probably a little bit of that too, but also very focused on physiatry and women and diversity and such. And so that one is at MV Gutierrez MD. It's really hard. You can't put the whole long name on there. MV Gutierrez MD. Yeah.
Great.
Very good.
And so we are still looking for residency programs to do IG takeovers. So please reach out to us. It's a great way to show off your personality and get your program out there so other students can see how great your program is. And so on Friday, we have Mount Sinai, New York City. They'll be taking over, so that'll be fun to see. But please, there are plenty of open spots, so we'd love to showcase your program. So reach out.
Our residents like doing it. They had a lot of fun being on there, all their talents. And
we would have had a ball if we had a chance to do it. Yeah.
Last-minute video of me talking that day.
And it's kind of like a competition now between programs. The firm's like, we need to rethink some things, which is really cool. Next Sunday, we're going to be focusing on spinal cord injury. This is the first time we'll have talk about SEI, and it's super important. So we're going to have Dr. Angela Vrooman, who did her residency with Sheena and I. She was our upper level, and Dr. Felicia Skelton, who is also in Houston at the VA. So they're going to talk about that. So be sure to join us next week, guys, at Saturday at 6 o'clock.
Yes.
All right.
One of my faculty at the VA. So she's in San Antonio.
Yep. Mm-hmm. Yes, she is. That's right.
She's one of our favorite teachers. So
she's amazing.
Yeah,
she really is super smart.
September is Spinal Cord Injury Awareness Month. I did not know that, but I saw that on Twitter the other day. So.
Perfect.
And next week is inpatient rehab week.
Oh yay, we'll have to celebrate. Yay. Awesome. Everyone says thank you. You guys are welcome. Thank you guys for supporting us.
Thanks so much for joining us. Yep.
All right. Well, this will be available on our Instagram, TV, as well as YouTube shortly. So